This is the Mid-Morning Talk with Julie Alli.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and welcome to the program. It is a Thursday morning, of course, and that means you're with me on the mid-morning show. Lots coming up your way. We'll be kicking off by talking with Dr. Fatima Bhabha. She's the co-founder of Beauty and Curves. We'll also be looking at a discussion with Dr. Emmanuel Taban. He is a pulmonologist at Mediclinic Midstream. He has an amazing story. You have to listen to his story. We move on, and Professor Susan Boyson will be joining us. She's the visiting professor at Wits School of Governance and director of research at the think tank, the Mapungubwe Institute for Strategic Reflection, also known as MISTRA. She'll be talking to us about the 108 years of the ANC's existence and, of course, their 25 years in power. What can we as South Africans expect going forward by the ruling party? Ms. Fatima Hassan, founder and head of the Health Justice Initiative, is going to talk to us about the rollout of the COVID-19 vaccine and the fact that it is not compulsory to take the vaccine. How are South Africans responding? What are the narratives that's going to change their minds? All of that and more coming up. Please stay with me right here on Salam Media. And as you know, we are all about humanitarian journalism. First up, my dearest, gorgeous Dr. Fatima Bhabha. She's the co-founder of Beauty and Curves. And today we're going to try and unpack the aesthetics beauty industry, which, as I understand, is a multi-billion industry worldwide. Assalamu alaikum, welcome to the program, and great to have you on the show.
Walaikum salam. Thank you so much for having me on the program today. I was really looking forward to chatting to you. So you're right, aesthetic medicine is a multi-billion-dollar industry around the world. I think in South Africa, though, it's taken us a bit longer to catch up with the rest of the world in terms of, I think, just being we're a third world country. I mean, we all know that. And catching up with the rest of the world is slower. But having said that, aesthetic medicine hasn't been left behind by any stretch of the imagination in South Africa. People tend to go for all the common things, so they do everything. It's just the more, I would say, exclusive, expensive ones that are kind of,
And we're going to talk about that. But Fatima, I must tell you, way back, I'm probably going back about 10 or even 15 years. And the first time ever I became aware of this industry, I was with a friend, I think it's a relative of yours, the Kara, Zaibun Kara. And she brought up this issue about, do you know these doctors, they're sisters, and they're in this field? And I was so surprised by all of this. And the reason I'm making this comment is that you as a medical doctor and your sister, I think three sisters are medical doctors, am I correct?
Three of us, alhamdulillah.
And way back then, like I say, 10 or 15 years ago, was the first time I heard about aesthetic, I knew about it, but I thought it happens far away from our borders overseas in first world countries. And she told me that you guys are the first and possibly the only Muslim female doctors that has entered this industry. And I was so wowed and wanting to talk to you guys, but also felt a bit intimidated. But having said that, you are now truly, that many years on, you and your sister are truly, I should say, specialists in your craft, in your field. Okay, I've lost you there. We can't hear you. We've lost volume. We've lost voice there. Let's try again. We can't hear. We've got a picture with Dr. Fatima Bhabha, but we don't seem to have any audio. Nope, there's still no audio. We're going to take a short ad break and see if we can fix the audio issue and come back, because this is an important conversation. So stay with us.
Connect and stay ahead with Salam Media. This is Salam Media, coming to you live from South Africa.
Kiki's, the taste with a kick. Our revamped exclusive restaurant and takeaway now opened. Kiki's strives to serve you and your family with a wide variety of delicious meals. Enjoy our famous chicken, shish, burgers, pasta, pizza, and many more weekly in-store specials. We offer Friday buffet and bripet with a difference. We cater for corporate functions, velimas, and events. Pajda facilities provided. Our exciting competition gourmet menu and new menu to be released at our launch. Visit Kiki's at 235 Matthews Mayue Road, Old Stemford Hill Road, Durban. Call 031 209 0119. Kiki's, the taste with a kick.
Hungry because of poverty. Penny Appeal's Breakfast Club aim to get a warm, hearty meal to underprivileged children so they can spend the day prospering in their schoolwork. Help feed a needy learner by visiting our website on www.pennyappeal.org.za or call 031 1100 573 to find out how you can donate. Penny Appeal. Small change, big difference.
Freedom Stationery supply Marlin and Marlin Kids pens to me and my school friends. They supply just about everything we need to help us get a better education, from books to files to rulers. In fact, any any accessory we need. Freedom Stationery. Education for the nation. What does accessory mean?
You are listening to the Mid-Morning Talk with Julie Alli.
And welcome back. Let's check if we can speak to Dr. Fatima Bhabha again. There was a problem with audio and hopefully it's back on again. Fatima, let's try that.
Assalamu alaikum. Can you hear me now?
Loud and clear. Go ahead. No, I've lost you again. Goodness me. What? All right. Okay. Just continue talking.
Okay. So, yes, we were the first Muslim, I would say, people of color and Muslim females to actually do it. So this was many years ago. So 15 years ago is when aesthetic medicine, so 15 to 20 years is when aesthetic medicine actually came into South Africa. So my sisters actually went into the field. So they started this that many years ago. And I joined them about 11 or so years ago. And I think what keeps it so, fun and invigorating for us is that we want to bring new treatments. We want to bring new things from around the world to South Africa. So we're trying to be innovative and not to keep us stagnant. But at the same time, we also like to bear in mind that Asian skin is very different to European skin. So Asian skins, the Asian muscles, even African, is very different from European. So the way we respond and the way they respond is very different. So that was a whole new learning curve for us, because in South Africa, whatever training you go for is very European orientated. So they don't really teach you much about the other skin types and the other colors. So that was a learning curve for us. And also,
for example, Fatima, give me an example. I'm fascinated. I never realized, I thought skin is skin. And I didn't realize that the color of your skin impacts on treatments or anything else for that matter.
So it does. It impacts greatly. So when we're talking just about a basic chemical peel, everyone goes for a chemical peel. So if I had to just ballpoint you, so skin is graded in what we call a Fitzpatrick scale. Okay. So you would be a 2 to 3 in the Fitzpatrick scale. So what I can do for you is a lot more than I could do for myself, because I'm severely tanned at the moment. So I would fall into like a 4 or 5. And that means my skin would react differently to a peel. It would burn more. There could be more scabbing. So the time I do the peel for, the type of peel I choose would be totally different in your case compared to me. And we are just sort of one Fitzpatrick scale apart. So if we had to go, say, 5 or 6, which is darker skin, then it even becomes more tricky because, as you know, Asians and Africans are more prone to getting pigmentation. So the way we approach and treat those skins is very, I would say it's really an art. It's a delicate art that comes with years of experience and, just doing the same thing all the time and knowing that, okay, I've got to do this, less amount of time. I can't use these peels on this skin type. So it's really not challenging, but fun because you have to be very careful.
Okay, tell me, how popular are these skin peels and why would you recommend it? The first thing that pops into my head is somebody who's got bad scarring from perhaps acne or something or the other. But does it help as well in people who want to turn the clock back on their age?
So I always say this to everyone. A chemical peel to your skin is like the air you breathe in your lungs. That's the comparison. So a chemical peel is not, yes, we can use them to turn the clock of time, but it's not the only modality. So a chemical peel on its own is not going to do that. When we talk about acne scarring, a chemical peel on its own is not going to take away acne scarring. But when we combine it with other treatments, so say, for example, I have a 65-year-old lady and she's like, I'm feeling, my body is really young, but my face is looking really old. And, people are living longer, and they exercise more, so their bodies are younger. In that case, we would, and this is a controversial topic to be bringing up on an Islamic radio station, and I'll tell you why. So the modality of choice is ideally it would be Botox. Now, Botox is controversial. Okay, so Botox is almost...
But that is being very, very widely used all around the world, including in our community. And the other thing I also want to throw at you, Fatima, and I'm actually horrified about this. We are all on social media, and I am on a lot of women's groups, and on some of them, or one in particular, a beautician, not a doctor, a beautician is offering Botox treatment. And I was horrified. And I thought, how can anybody it's literally putting your life in the hands of a beautician. I can understand dentists doing these type of treatments, Botox fillers, etc., and you're going to give us a rundown of all of that. But a beautician or a hairdresser.
So at the moment, South Africa is very strictly governed. Okay, so only a doctor, a dentist, those are the two people that are allowed to perform Botox or fillers on your skin. However, there are a lot of beauticians, there are a lot of hairdressers so the hairdressers mostly are doing the hair treatment. So that's a different area altogether. We don't even go there. But I have found that there are a lot of non-registered people who are offering Botox and fillers. So I would just like to put a disclaimer out there is that, firstly, your face and your skin is the only face and skin you're going to get. You can't get another one. Okay.
Right.
So please be very careful about who you allow, who's going to touch your face. Do your research properly. Make sure the person is registered, firstly, with a legitimate board. Because remember, then they are accountable to someone for the work that they are doing. So that's number one. And number two, please go to someone who's qualified, we studied a long, long time. I did a diploma with the aesthetic medicine, with the American aesthetic medicine. I've done, so aesthetic medicine at the moment is like it's a diploma. So you've got to, study those years or whatever. And then we're always updating. So, I would say at least twice a year, I'm trying to add onto my resume because it's an evolving
Art. Yes.
Yeah, it's not stagnant. So those are the two things that I would like to just, make people aware. It's very important. Be cognizant of the person you're going to. That's the first.
Okay. All right. Let's come back to the controversy issue, the controversy with Botox.
So the thing with Botox is a lot like gelatin. So some people would eat any type of gelatin because remember, you can't turn it back into the original form. Whereas other people would stick to sort of, bovine and fish. Okay. The thing with Botox is that it's cultured on a bovine petri dish. So it's put I'm not sure if you people are aware that in a lab they culture things on a round little, like a bowl. So that bowl is either bovine or pork, but they've moved away from pork now many years ago. So it's bovine. So that's where the controversy comes in.
Okay.
And the second controversy is that a lot of ulama say that you can't change your features, that you shouldn't be changing your features. And I'm very in agreement with them. So if you come to me, we would never change you. We kind of just keep you the way you are and try and make you look a better version of yourself. So if you come to me and you say, look, I want to be Kim Kardashian, I would say, I'm sorry, I can't do that for you. Even though it's possible. I mean, there's a lot of things we can non-surgically do for you. But I just feel that that's not right. Changing someone totally is, then you need to see the psychologist and the psychiatrist, and you've got a whole lot of other issues going on. So that's the Botox. Then we come to filler. So filler.
Okay, Fatima, let's just backtrack. What exactly does Botox do for you or do for the patient?
That is a brilliant and a very good question. So if, for example, you look at my forehead, okay, it doesn't wrinkle. Okay.
It's gorgeous.
I'm being honest because I don't. So if you look at my hand, do you see those lines there?
Yes.
When we do that and we open up, those are what we call static and dynamic wrinkles. Okay. So what Botox does is it actually paralyzes the muscle so that you don't get those movements. So you don't end up with those lines that you would get. Like if you look at my hand, you end up with such lines on your forehead. So that's what Botox does. It paralyzes the muscle, but it's not a permanent paralysis. So this is what people need to understand. So Botox acts on a receptor in the muscle. It just blocks the receptor. And it only lasts for about 3 to 6 months, ideally, depending on how your body will break it down. People who exercise a lot, women are on hormone replacement therapy, they need it closer to 3 months than 6 months because your body is breaking it down faster. That's really pretty much it. So it's just preventing you. So for example, if I can give you a live day example, is if we all looked at our grannies, they had those wrinkles, but the wrinkles were stuck in their forehead, literally. So even if they were not frowning, they were still frowning.
Right.
So Botox actually just helps that not happen in the in years to come.
Softens your features, make you look younger, makes you look fresh. But let's talk about we know in science, anything that you ingest or inject into or onto your body has a side effect. What side effects should we worry about?
That's the beauty part about Botox. It acts locally. So it's not taken into your body. It just acts where you're using them. And the common areas is the forehead, sort of this frown area here, the crow's feet around the eyes. And there are other places that we can use them. So people who grind their teeth, I mean, this is a beautiful one. So people who grind a lot, they end up with this really huge muscle here. It makes them look like chipmunks. So we use it for that. We use it a lot also for people with migraines. Very commonly used in people with migraine. So those are the common uses for Botox. Another common one is excessive sweating. So for people who excessively sweat, for them to do it in the summer months is very good because when you lift up your arm, you don't see that splotch of perspiration in your arm.
Okay.
Those are the common uses of. Well, we don't call it Botox because Botox is a registered name. So we call it a neuromuscular blockade because you get different types of neuromuscular blockers. Botox is one trade name, and then you get Dysport, and then there's many others. In South Africa, only 2 available. So Botox and Dysport.
Okay, Fatima, I think this interview around this issue, aesthetics, is going to be an ongoing one, because no ways can we do justice to it in the half an hour that we have. In fact, we've got 5 minutes left. We'll try and push it a little bit, but I think that there's just so much of information to share with everybody. So I'm hoping that you're going to be available, more often for me for just a half an hour at a time.
But so let's just keep this one to the Botox. Okay.
Okay.
So what we're saying is we want to ideally paralyze the muscle or soften the wrinkles or kind of, smoothen them out a bit. So what is very new in that category is something called threads. So a thread is like a little, a stitch that you get when you've gotten cut or hurt, and they use that thread to stitch you. That's the sort of technology behind it. But on that thread, there is hyaluronic acid and polycaprinolactic acid. So for all the ladies who feel that they don't want to get involved in the controversy of the Botox per se, this is a very good treatment for you. So you basically, say for example, we have these really bad wrinkles here and we want to soften them. We would put in a thread in this direction. So like this, into this area here. And what that does is very similar to what the Botox would do. It softens and pulls the skin, more taut and gives you a fresher, younger, sort of anti-aged look. Now, the benefit of putting a thread over a Botox is that, or a neuromuscular blocker, is that it lasts a bit longer. So it lasts about 2 to 3 years.
Oh, and costs? Difference in cost?
The thread is a lot, not a lot. It's more expensive, obviously. And that's why neuromuscular blockage is so popular. It's cheap, it's quick, it's a lunchtime procedure. A lot of people pop in, in their lunch break. And in terms of side effects, there are. So you can get bruising. This is an extreme side effect. So if you're doing the treatment to lift the eyebrow with the neuromuscular blockage, you can sometimes get what we call a droopy brow. It does happen. And it happens even in the most experienced hand, because if the Botox migrates, it's technically out of our control. Alhamdulillah, in my sort of 12 years, it's not happened yet, and I'm hoping it's not going to happen.
Inshallah.
And having said that, it's not a permanent thing. Remember, it only lasts sort of 3 months if our patient is patient enough. But there are also ways to reverse that. So those are kind of the varies. When we're looking at threads, it's more invasive. So it's almost like us putting something into your skin. It takes about a week or so of downtime. You can get excessive bruising, but the results are, if not better, than if we use the neuromuscular. Because remember, you're getting anti-aging, and you're getting lifting, and you're getting softening all at the same time. So
okay, now let's ask this question. There's still a gazillion other questions, but I'd like to leave it for another time. We hear about all these amazing skincare moisturizers and creams which contain, is it hyaluronic acid or right? What's your take on that? Because they all seem to be vying for shelf space, and they all claim to benefit you. So if you use it, and also collagen creams that contain collagen, you are promised that it's going to give you a youthful look after using it for X amount of months or years or whatever. Your take on it?
Okay, so when it comes to moisturizers, creams, all of that, for me, I think a cream that you put on your face is very important, because remember, the foundation of anything is the cream that you're going to put on your face. So it's like building a house with no foundation. However, having said that, a lot of these off-the-shelf sort of products are so they have all the right ingredients, they just don't have them in the right concentrations, basically. Okay. You will get, using collagen on your face is extremely beneficial. However, drinking collagen is much better, because remember, elastin and collagen is inside your body. When we look at the skin, elastin and collagen is in the 6th layer of the skin. So penetrating from the top to the 6th layer is slightly iffy. I mean, if you do a derma pen or a laser and you put it on, yes, directly gets there. But you will still get a benefit. It's not that you're not getting any benefit. Even the hyaluronic acid that you're putting on your face, you definitely get a benefit from it because it's plumping, it's hydrating, and it goes into the pores and the channel. So when you're looking at a product for your skin, I always advise people to use what we call neoceuticals or cosmeceuticals. So they're almost products that are made in a pharmacy, like medication for your skin, but they come in pretty bottles, and the results are quite phenomenal compared to the off-the-market ones. Now, a lot of people, the biggest question is, can we afford it? Is it not going to be too expensive? Because if I go to Clicks and Discount, it's much cheaper for me to buy it from there. So I always tell everybody that we really pride ourselves in also affordable aesthetics. Everybody should afford to look good. It shouldn't be only for the wealthy, because that just makes no sense. So we always will tell you that you don't have to buy everything at the same time. You can always start with a cleanser, and then the next month we'll add moisturizers and serums. So even when you repurchase them, you're going to buy them 1 month at a time, because remember, they all don't finish at the same time. So if you stagger your purchases, you will repurchase them also staggering. And the nice thing about neoceuticals or cosmeceuticals is that they always last more than a month. So they last 2 to 3 months, because you have to put so little to get a good effect that you're using. The only thing that lasts, I would say, not so long for us is the moisturizer, because every time you make wudu or you read salah, you're going to reapply your moisturizer. But the rest of them last quite a long time.
Okay, Fatima, you're not going to believe this. We're almost at the end of the show. Very quickly, is this practice, aesthetic medicine, looking good, turning back the clock, going for botox, fillers, and everything else we're going to talk about on future shows? Are the men folk, are our Indian Muslim men catching on? Because I do know that men in the UK and in other first world countries are onto the bandwagon.
So they are. So it's not just our Muslim men. I think men in South Africa in general are on the bandwagon. Because if we've all noticed, there's a huge shift in the trend where men want to look good. They also want to, they don't want to be aging. They do, I would say, neuromuscular blocking more readily than the fillers. That's the one difference that I have found. But in terms of skincare, in terms of peeling, in terms of treatments, they are there, and they are at the party, and they are looking after themselves. So
absolutely fascinating. Can't wait to talk to you again. Hopefully next week, if you are available, or next when you're available, we'll pick up on fillers and all the other popular popular trends that people are following, and if there are side effects, and the do's and the don'ts as far as aesthetic medication is concerned. Thank you indeed for being with us. It's been very informative. Thank you, and Assalamu alaikum.
Wa alaikum salam.
That was Dr. Fatima Bhabha. She has a practice in, I think it is Bedford View, and in Rosebank, Johannesburg. She and her sisters have been in this industry or in this field of medicine for the past 15 years, and they are definitely your go-to people if you are considering perhaps turning back the clock as far as your looks is concerned. 11:34 exactly. You with me, Julie Alli, on, of course, the mid-morning show. And next, we're going to be talking to another medical professional, and he is Dr. Emmanuel Taban. He is a leading pulmonologist whom I believe is saving lives of critically ill COVID-19 patients.